The award-winning Professor Valerie Mizrahi attended the 2008 Scifest Africa to discuss the global TB crisis. Her research has made groundbreaking scientific advances in the development of TB drugs.
Let's not underestimate it. TB is a huge problem. Can we go much higher than where we are now? We've got an incidence rate that's in excess of 1% in this country. It's the highest in the world. But this is not an impossible medical problem, and I'm optimistic.
We take a closer look at the effect this disease of the poor is having on local communities. Liseka Mnguglandlu is 31 years old. 3 months ago, she found out that her and her 5 family members were infected with TB. Every morning, Liseka and her mother take their medication. At Joza Clinic, she waits with the other patients to collect a weekly supply of TB treatment for herself and her family. Joza Clinic is one of 8 clinics spread across Grahamstown. It's the busiest clinic, helping 265 TB patients. Sister Vuyiswa has been working here as a directly observed treatment supporter, also known as DOTS, for the past 10 years, and Liseka is one of her many patients. She explains her role as a DOT.
Firstly, to admit the patients, to send them to the doctor, to do the education, and see that they've got food gardens at home so that they can eat vegetables when they're on treatment. And you cannot work with TB if you don't like it, I'm telling you, because really, the clients are really provoking. So you must love that job. You must love it.
I certainly think that DOTS is the best that we can do to standardize and use the drugs as effectively as we can, and particularly compliance with DOTS will minimize the acquisition of drug resistance.
TB bacteria is highly contagious. People with untreated TB can transmit the disease by simply coughing or sneezing. But once patients are on medication, the disease can no longer be spread. The dosage for TB medication is determined by the weight of the patient. Taking the pills once a day for the full 6-month period can result in complete recovery. People are most vulnerable when their immune systems are low. Therefore, the disease is most evident in poor communities where people don't have the necessary resources to keep their bodies healthy. Successful treatment depends on a healthy diet to strengthen the immune system and minimize some of the unpleasant effects of the drugs. In the afternoons, when the children come home from school, it's their turn to take the medication. TB treatment involves combining numerous antibiotics to fight the deadly bacteria. This can lead to severe side effects.
When I just started eating the treatment, every time I feel so nauseous.
Along with the physical effects of TB, there are also social challenges.
You do have discussions in our class in life orientation about TB. And people just react like it's uncurable. They just think that if you have TB, you have HIV.
As the community works together to solve the problems surrounding TB, there are also many scientists across the globe working on the crisis. For Mizrahi, the solution lies in science and society working together to defeat the silent killer.
Scientists need to engage and work together with public health specialists, with sociologists, with economists, to try to tackle the problem in a multidisciplinary way. Because on its own, I really don't think that science can help, but it's not going to on its own solve the problem.